Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Pediatric Assessment, Episode 3, Assessing the School-Age Child. After viewing this episode, participants will review physical and developmental characteristics of a school-age child. Participants will review the barriers that influence the assessment of a school-age child and how to reduce them. Finally, participants will review normal and abnormal physical findings, vital signs, and weights of a school-age child.
School-age children are much more like smaller adults, even though we usually don't like to think of children as small adults. By the time they're 8, 9, 10 years old, their anatomic structure and their proportions are very similar to those of adults. These are kids that are starting to sit in booster seats in cars. They'll be tall enough to perhaps not be in a car seat at all. Their airway should be very similar to that of an adult. These are kids that you can often start to use a curved blade on if you need to in the setting of an intubation. Their teeth are certainly well formed and all should be present. However, it's important to note that these kids often will have loose teeth because they're going through the normal process of losing teeth, and that's something to keep in mind in the setting of an airway emergency. Their organ size is starting to balance out and should be more in proportion to the rest of their body. So you still could see some hidden or some surprise internal organ injury in the setting of a motor vehicle accident or some type of blunt trauma, but you should start to see more outwardly signs such as bruising or other evidence of trauma to the specific body area. School-age children at times can be the size of a small adult or certainly an elderly woman. We see a great range of weights in this age group because in some children as young as 8 or 9, puberty has started, and that can certainly cause their weight to increase quite a bit. Vital signs are going to be similar to that of a teenager or a larger person. Again, seeing a large amount of variability. You could have heart rates as low as 60, as high as 150s or so, without there being any problem. Respiratory rates can range from the low teens to the 30s, though anything higher than 30s would certainly be abnormal. Again, if you see a child with nice, quiet, calm respirations that are fast, that's going to be less concerning than a child who has a low respiratory rate but seems to be working very hard to get that respiratory rate.
The school-age child is more like an adult in terms of anatomy and physiology. Organs are more proportionate to the body than toddlers. However, they are still at increased risk of injury from trauma. Teeth should be present, but they'll be in the process of losing them and replacing them with adult teeth. Weights vary due to puberty, but will be around 22 to 45 kilograms. Vitals will be similar to teenagers, although respiratory rates and heart rates can be variable.
A school-age child should have a great grasp of language and should be able to really understand what's going on. So being very honest with them and talking with them should get you pretty far in the exam. You always want to make sure the child knows if something's going to be painful. Let them know that ahead of time, because the worst thing you could do is surprise them and accidentally hurt them. But cooperation is usually not a problem in this age group, so I would suggest go ahead explaining what you need to do and then just going along with the process. The child should be able to cooperate just fine. In this age group, developmentally, children are usually quite eager to please. They're usually very happy. Some can be very shy, but again, they want to do the right thing, and so they're going to really try hard to give you what they think are the correct answers. So it's very important that you ask open-ended questions. Ask the questions maybe just once if you're not sure about their answer. Don't really press the child on it because they're going to be looking to really try to please you. So they might be concerned that they have pain. They might be concerned that their injury was their fault, and they won't want to necessarily tell you the truth. Engaging the parents to remind the child that they're not in trouble, that they didn't do anything wrong, that they're in the process of being helped is going to be very, very important because they just want to make sure that they're doing everything right.
The school-age child is the one that's riding the bike, on the skateboard, now in school playing sports, falling off the playground, things like that you're getting into now, injuries where you may not have that with the younger toddler. Those are type of considerations. We start seeing more of the injuries, overdoses with that age. School-age children, I should say, are a little bit more talkative, not as fearful. They like to tell you what is going on. They'll answer your questions directly. Usually pretty interactive, however still fearful like the toddler, so also need a lot of explanation and support. They want to see a friendly face. They want to see somebody that they can trust and staff that will interact with them at their level.
The school-age child will have a good grasp of language and will be able to understand the situation. They'll be eager to please and provide answers they perceive to be correct. Thus, it is important to ask open-ended questions. The school-age child will have anxiety regarding the situation, and reassurance and honesty is important in this age group.
So with the school-age child, again, their appearance, if they're listless, if they're not interactive, that is concerning, and they'll raise some red flags, or should raise some red flags in your assessment. If they're having appropriate responses to you, so if you are coming towards them and they are not nervous or not wanting to go to their caregiver, that is also part of your assessment that's kind of really concerning. Lung sounds and how they're breathing, again, in this age group is very, very important. And their activity level. Is it decreased? Is it increased? And their eating habits. This is where they start to grow pretty rapidly and during this age group, and eating becomes a really big part of their day. When assessing a school-age child, the hardest thing I think is for us as EMS providers is not to talk around them. So really to ask them direct questions, asking them, does it hurt here, does it not hurt here, to be able to take deep breaths, not asking directly to the parents, but asking questions directly to the child, as well as remembering that we have to keep their modesty intact, and that's one of their highlights that they are most worried about. And then also be on alert for not only trauma, but also for abuse, because this is another high risk group for child abuse. A lot of the barriers with school-age kids is this is where they start to become worried about modesty, and they're really nervous about somebody coming in and taking off their shirt, or wanting to look at their legs, and wanting to assess them. So you first have to address the whole modesty issue. This is where you may have to elicit some caretaker, maybe take the child into another room so there's not a lot of people standing around while you're assessing them, and also find modest ways how to assess them. If you need to put the stethoscope underneath their shirt, not taking their shirt up completely off. You have to remember that those are some ways that you're going to be able to overcome the modesty. The wide range of ages on this group, some of them may have just, on the lower end, 5-6-year-olds, maybe they're just coming out where they're just starting potty training, and you may understand that there may be some responses to nervousness and stuff by bedwetting or wetting their pants. You have to elicit the caregivers and things, is this normal or is this abnormal for your child? And really getting them involved in things.
Difficult assessments with school-age child makes me think of any child in any type of respiratory crisis, trauma crisis. It's very difficult too, because you have the family right there, so you find yourself trying to support the family and dealing with the child, and usually you might have to set the family aside and say, I need to take care of your child right now. And I think that can always be a difficult situation to be put in.
There's one that he was hit by a car. He was on a scooter and he was hit by a car. Some of the things that was the most challenging part of this assessment was that because the caregiver was there, he would not answer my questions. He just kept wanting to go to the dad and, Dad, it hurts, and really trying to get him to focus in on what we were asking him and how we were moving him and complying with what our instructions were as we were trying to backboard him and collar him and get him immobilized. It was partly the most challenging part, and to really be able to remain calm and not overstep our bounds with the parents, but also accomplishing what we needed to accomplish while we were mobilizing him.
Appearance and level of interaction is an important gauge for assessment. Other considerations include activity level, appetite, and general responses. Child abuse is prevalent in this age group. Strive to respect the modesty of the school-aged child. Parents are important in the assessment, however, parental presence may influence a child's response. After viewing this episode, participants will review physical and developmental characteristics of a school-aged child. Participants will review the barriers that influence the assessment of a school-aged child and how to reduce them. Finally, participants will review normal and abnormal physical findings, vital signs, and weights of a school-aged child.